this guidance is there to assist local government in particular, but not just local government, all employers in public health, including Public Health England, in making the right sorts of choices about how to provide the right sort of environment for our people.
The standards really set out quite clearly what the 5 different areas or elements of effective public health working are. So you have continued professional development, you have professional registration, and you have workforce training and development. So that's great. But then it also puts out a standard around workforce planning. And the one I really like, though, is the 5th element around partnership working, because that clearly sets out how public health is a multidisciplinary discipline. And to be effective, public health teams and staff need to work across an authority, plus also with wider partners.
We are giving employers advice on the things which they need to take account of in the employment of public health staff, and these are examples of good practice. Beyond that, they provide links to a variety of other documents which give people much more detailed advice about particular issues, many of which are comparatively new to local authority employers. We're not trying to tell employers how to employ us. We're not describing all the things which employers will do anyway.
I think it has been incredibly valuable that we've had these various main bodies coming together, the public health world, local government world, to form these standards for local government when they're taking forward those employees. We really need to have the best of the world, and I think it's giving us that guidance, that best practice that will help us to look for the very best for our own authorities.
Well, I think for public health workers they'll be very much warmly welcomed, and for consultants and directors of public health it'll be very important for them to know that these standards actually maintain the very high standards we have as a faculty of public health for recruitment, by ensuring that all people in the recruitment process, both consultant and director of public health level, will actually be registered and fit to practice.
The Association of Directors of Public Health was involved in the development of these standards, and I think they really will be endorsed by our members, the Directors of Public Health, because they reaffirm those elements that we need to ensure that we can effectively deliver health improvement in local areas.
Public Health England has a big part to play in promoting these standards. Within Public Health England itself, because we're a big employer, but across the whole of the sector, government, but broadly, anyone who's involved in providing public health or public health services will be there saying, look, if you want to know what good looks like, you don't need to look further than these standards.
Well, standards are available now, and they can be accessed in a variety of places, but the primary point of access is the LGA website.